this is where I make my money right here in
Yeah,
Tendon
yeah,
Center.
yeah.
Like, so it's not
Pay
as
attention, people. Start taking notes right now. Yeah.
it's not as easy as like.
Dr. Jonathan Sanburg, we're
Hello.
here. This time I'm not on the table. We're in chairs, but you're my guy. And I've been coming to you for almost 3 years now.
Yeah.
To the Kime Performance Physical Therapy Center here at Uriah Faber's Ultimate Fitness Gym in Sacramento, a Sacramento landmark. And I thought, hey, we should get on the podcast sometime and talk about this wonderful world of, you'll probably define it better than I, but I think it's like, sports-minded, performance-minded physical therapy,
Yeah.
as opposed to maybe the compare and contrast to the old school, getting hurt, resting, coming back, and taping it up, whatever. So
Yeah.
let's get into it, man. Tell me about your career path too, which is really interesting, and what we're doing here at the Kime Center.
Yeah. Well, one, thanks for having me on, Brad. I'm super excited to be here. So yeah, my career path, like most sports physical therapists or physical therapists that get in, I would say sports performance. That side, sports medicine. You're an athlete, you get hurt. So I
Yeah.
tore my ACL as a kid.
Oh.
So I ended up going to physical therapy, and my physical therapist then is now the CEO of this company, which I work for, Kime. And so through that process, I was like, oh, this is kind of fun. I was getting towards the end of my ACL rehab, and I was asking my PT, I was like, oh, hey, Tone, like, can I intern? And I was a high schooler at the time. He was like, yeah, sure, we can figure something out. So I started interning as a junior in high school, I think, sophomore, maybe something like that. And I was like, man, this is cool. Like, this is really fun. I could see myself doing this one day. I'm not someone who wants to sit still all day and be at a desk behind a computer. And so, from there, decided I would go to physical therapy school, went to undergrad, and kind of chose my undergrad degree and where I went based off, the hopes of getting to PT school.
Yeah.
It's pretty competitive nowadays.
Hmm.
And then through that journey, I did a lot of strength and conditioning and learning, the weight room, doing strength conditioning internships. I had the opportunity to work at Exos as a strength coach intern. I had the opportunity to go to Exos during PT school in
Tell us
Florida.
about Exos.
Yeah. So Exos is a physical therapy performance training facility. You'll hear their name a lot in circles in terms of like the NFL Combine. So there's roughly, guys that are trying to go from college football to the NFL. There's I think roughly 300 that get invited to the NFL Combine. They do the 40, the high jump, the broad jump, and then some skill drills and speed drills. And they train I want to say it's like half of them, or roughly half the guys across their different facilities. Wow. They provide sports performance training, not just to professional athletes in the off season, but also physical therapy, and then training to youth athletes. Even the everyday person can go in there. In terms of like the locations I was at, I got to intern in Arizona and Florida, which are two larger locations, and everything's kind of in-house there. So they have nutritionists, massage therapists, physical therapists, the strength coaches. It's all kind of like a one-stop shop.
So when they invite these combine guys over, are they like, going to bill them later when they sign their contract or something? I mean,
so they're not billing them; they're billing their agent. So it's really the agents and the agencies that these athletes sign with, where they really determine where they go. For example, I worked with a combine athlete from Sac State. He's a lineman, and so the agency he signed with, the guy was like, "Hey, you're going to go to Exos. You're going to go to Arizona for your 8 weeks for combine training." And so he had tweaked his knee before going to Exos, so I was helping him through his MCL rehab, and so I was telling him all about it. It was kind of fun because I had already lived it and done it, and so his agent put him there. They put him up in an apartment. They front the load the bill. It's not cheap. And then once you sign your signing bonus, I think that's subtracted out of your signing bonus.
I mean, hopefully they get drafted. Otherwise, possibly it's an investment in a bust.
Sunk costs for sure.
Yeah, sure.
So
places like that and places like Kime here, where we're inside this amazing sports training facility that Uriah Faber built for the fighters, are especially nice to watch when I'm getting treated on the table and looking over, and some of these world level guys are going through their sparring and stuff. But it seems so different from my previous experience of going to sort of looks like a doctor's office or a medical office. And your physical therapy consists of rubbing the wand with warmth on your injured knee, and then you go home and rest for 2 more weeks. So how did this thing blow up into the cutting edge of sports performance and injury rehab kind of blended together?
How did Kime blow up, or just the
Just the whole
profession itself?
industry?
Yeah,
and
the
then,
industry. Yeah. So, well, one, that's like the image I still think it's not just you, but many people still have about physical therapy. When people are like, "Oh, what do you do?" And I tell them I'm a physical therapist. Like, "Oh, yeah." So like they have this image, right? And that's the image. You go into this business district, right? And you go into a building and they've got some PT tables. They maybe have a stationary bike, a treadmill,
Mm,
and they don't have a weight over 10, 20 pounds. 20 if
right.
you're lucky, right? And
Yeah.
that's it. It's carpeted. There's no weight rack. There's no dumbbells. There's no kettlebells. There's no trap bars. There's nothing, right?
Yeah.
And so that is, I think, sports medicine, I think probably started more so highly in pro sports, right? And then it kind of got filtered down, right?
Yeah.
Where the physical therapists are coming out of school, are like very sports minded, but maybe couldn't get jobs in pro sports or college sports. Like, oh
Oh,
man, I want to treat athletes. I want to help these people. I want to help everyday active individuals like yourself, those that run marathons, those that are cyclists, those that are track and field masters athletes, master swimming athletes. So it's kind of, I think, becoming an extension where, you come into a place like hopefully us, like Kime, and you get this, what we would say is, hopefully a world-class, professional sports experience where you were treated no differently than them.
mhm.
The exercises, the progressions, and the load you're put under is no different than them. It's obviously catered and specific to you. And then with our network being the network of surgeons that we have in our area that we coordinate with that our specialists, whether it's in the Tommy John of the elbow
Mm,
for like our baseball pitchers,
mm,
whether it's the ACL for any of your field sports athletes. We kind of know who in the area and who is elite and the best at what they do.
yeah.
There's a Dr. Sean Robinson out of Elk Grove moving to Folsom, who he's one of the A's surgeons.
Mm,
Dr. Hunter Green is also an A surgeon out of Citrus Heights Rancho here.
yeah.
So like these are world class surgeons right here in the Sacramento area that we have a strong relationship with that we can send Johnny or Tommy to get his Tommy John done by,
Yeah.
which is pretty cool. And
Yeah.
then we have reach within just your sports med GP doctors, your all these other medical professions that when you come see us, you hopefully get a world-class professional experience where it's not just the physical therapy, but if we need to, divert you somewhere else because we need another look or eyes on something else, we
Yeah.
can.
So I guess you got people coming in off the street injured, or perhaps coming in after their surgery or whatever and
Yeah.
found you, like I did. I was
Yeah.
going to physical therapy. This was up in Tahoe at PT
Yeah.
Revolution.
Yeah. Yeah.
Very similar to here,
Yeah.
where it's
Very.
in a gym with exercises and equipment everywhere. And finally, they said, "Brad, you quit coming here. You need to go get this Achilles worked on because this giant bone spur ain't going
Yeah.
away.
Yeah.
Then come back." And that's when I got set up with you, was
Yeah.
after the surgery. So I guess, is that happening on both sides, where you're coming in post-medical and then pre-medical, hopefully with the decision of, do I really need surgery or can I get this right without it?
Yeah, absolutely. It's spot on. It's a combination of both. It's the youth athlete gets hurt on the weekend,
Yeah.
or adult gets hurt on the weekend. Mom or dad or someone tells them, "Oh, go to Kime." So then, they schedule, they walk in the door, and then we kind of assess and go from there. And then it's obviously the opposite. The relationships with the surgeons, the osteopathic doctors, the pain med and rehabilitation doctors are like, okay, you have Achilles tendonitis, or you
Mm,
had hip replacement, you had knee ACL surgery. Here's where you're gonna go to physical therapy,
mm.
and then so yeah, it is both.
It seems like still a remaining problem is that the first step we generally take in the general public is we go see the doctor,
Yeah.
like the orthopedic surgeon. And that's what happened when my knee was hurting.
Yeah.
I was directed to go straight into the orthopedic surgeon, and I didn't need any of that. I needed a sports-minded physical therapist. So can someone like call up and make an appointment and come in here and get insurance coverage or whatever to get
Yeah.
assessed before they see a doctor? And is that like something that you'd recommend, or is becoming a new standard as opposed to the old standard?
Absolutely. So, I don't know how recently, but within the last 5 or 10 years, physical therapy has become like direct access. So yes,
Nice, right?
you do not necessarily need to right away go get a referral or a prescription, let's say from a surgeon, a doctor, a
Mhm.
GP to come to physical therapy. You can call us, walk right in the doors, and
Yeah.
we'll take care of you. And then within a certain amount of time, according to like state laws and stuff, we do then have to like send our medical note out to just continue care if
Yeah.
need be, kind of thing. So
Yeah.
yeah, absolutely. And I recommend too that like wherever you are in the world, in the US, if you have a strong physical therapy, sports medicine clinic in your area, go seek them out, because we view ourselves much of the time as like we're kind of your quarterback, right? Like I said, people come
Yeah.
to us and let's say they haven't seen any other medical provider,
Yeah.
and we start to work with them. We're like, oh, okay, like we've definitely taken this far, but there's something just kind of like not right quite yet. Or
Mm.
like we need to maybe go see a surgeon, or we maybe need to go see a PM&R doctor about like an injection, a
Mm.
PRP or cortisone or something,
Yeah, yeah,
to maybe bring down some pain in a different way.
yeah. Mm. Um, well, I wonder, like, is there a certain percentage of your clientele that are coming in just to get better, or is pretty much everyone injured or complaining?
Yeah, so it probably depends on, I would say, your experience with us. Like I have some patients that I have treated for injuries and that they come back to see me and they're on more of, let's say, like a performance, basis where they're asking for advice on training, on performance, on how do I set a PR at my marathon? Hey, how do I get stronger for this? Or hey,
Mm.
I'm a college soccer player. I'm gonna be home for winter break. Can you kind of help me with my off-season training? And I want to improve in scenarios X, Y, and Z. So it's both, right? It's that they've had previous experience with me or with someone in our company, and they
Mm.
come back for more help
Mm.
because of the value they see we provide them. And then it's, other people that see me because they broke something or they have something torn, and then it kind of like turns into like end up pseudo performance training. Because like, oh my God, you've helped me so much. I want to continue working with you. I trust you. Like I have an older lady. She had a disectomy and we got done with her rehab. I was like, you're good to go, my friend. Like,
Mm.
I deem you healthy or fit. You don't need me. She's like,
No, I don't want to stop.
yeah, she's like, but Jonathan, I want to, I trust you.
Yeah.
You know what I've been through, and I don't know if I trust someone else to like program the weight room for me
Mm.
because they don't know my history. And so
Yeah.
she continues to see me from
Nice.
a performance perspective, and I,
Yeah.
continue to provide her what she wants in her life, what she needs.
So you mentioned that you were also studying strength and conditioning. Was that
Yeah,
like personal interest that help you with your your resume or getting accepted into PT school that
yeah.
you brought that other thing in and do a lot of PTs do that?
That's a great question. So I think it started as personal interest and then it became the realization of, oh, wow, like, you kind of mentioned earlier in the conversation, like, how did sports medicine come about? And, you'd only ever been in physical therapy facilities where like, not looking like ours, a big weight room kind of thing.
Yeah.
Well, I started to realize and learn at a young age, man, like load meaning the weight is what moves the needle, right? That's what causes the
Mm.
adaptation, the stress, right? You talk about like saunas, you talk about cold therapy, you talk about fasting, right? Those are all stressors on the body in some
Mhm.
way, shape, or form that acutely have a really positive impact on the body for like health, life
Yeah.
longevity, just like weightlifting does,
Mm.
right? So it became it was kind of an interest at first. Oh, I want to get stronger. I want to have bigger biceps,
Yeah.
bigger chest, or I want to be able to, run faster down the soccer field. And then it turned into a realization, oh, wow, like this is really what sports medicine is to a large degree is manipulating load, applying load at certain times and certain
Yeah.
amounts in certain ways to then hopefully facilitate the recovery or the increased performance of our patients or athletes.
Speaking of load, man, when I came in here, I think it was, did they send me 2 weeks after surgery? I think there were some
Something like
times where
that,
it was
yeah.
really short. Maybe it was 1 week.
Yeah.
And I came in and I'm like already trying to get the award for the most wussy client that you've ever had. Because I was like, so anyway, Jonathan, it still feels a little hot around here in the morning. And then sometimes it changes up to here. And you're like, go get a 45-pound kettlebell, go sit on the thing. I want you to put the kettlebell here. I want you to do 2 sets of 20.
Please.
And so I do like
I
one set
remember.
after surgery, my first thing, and I'm doing the set. And then I come back and go, yeah, well, it is kind of feeling a shooting little, it's maybe dull and maybe shooting. Like I just was so worried that I was messing myself up because we've been so programmed over
Yeah.
time to be like, well, I had a little procedure. Now I'm going to rest 6 weeks and cross my fingers and hope when I come back and start in with my sport that everything is going to be fine, which is now we can realize what a ridiculous notion that it is.
Mhm.
But it's still, a lot of people think that way. I finally got my buddy, Dr. Steven, in to Kime. I'm like, call up Kime, because he had a hot side of his foot
Oh, yeah,
that
yeah.
was so bad that he couldn't run for months. And he got a MRI and everything was fine.
Yeah.
And so it's like, well, what's going on? This hot spot you could actually see, but there was nothing to do. And he was waiting. And
Hanging
then he
out.
finally came in and had an assessment like, oh, by the way, your ankle mobility sucks and you need to do this, this, and this. So it was amazing awakening for me that like, here's a surgically repaired Achilles tendon, which is so delicate and sensitive anyway. And I'm coming in here and I'm getting to work every time. This guy had no emotion, no like no empathy for my little complaints. And then the next week I'd come back with a slightly varied complaint. And he's like, all right, kettlebell on the knee, 2 more sets. Then we're going to the pogo pops and all the other stuff.
Yeah, yeah.
So it's pretty wild how this has changed. And I don't know, give me like the scoop in major sports as well as everyday clientele, how things are different now and how it's all about load and
Mm,
strengthening your way to.
yeah. So different. So like from you're asking like
I mean,
how do we
where does rest come in now and
yeah, yeah,
deactivity
yeah,
versus is there a way for almost everything to come in here and do something
for
about it
sure.
instead of sit and wait?
Well, I'd say like the short answer can always be there's always something you can do in some way, shape, or form to probably move the needle forward. And so, like a good example I would say is right now, like I have a youth athlete who had an injury of the hip, and then there was a healing time where they weren't allowed to do anything as a tissue is
Mm-hmm.
had to heal. There's safety precautions around it
Mm-hmm.
sometimes, right? Like with let's say some of our shoulder surgeries, our Achilles operations, our big surgeries, there is a time where like okay, like doing nothing on that joint specifically is needed. Protect the graft, protect the
Yeah.
joint a little bit. But that doesn't mean like, you couldn't, let's say if you had an Achilles operation, you couldn't get on the ski erg, right? And like get the heart
Mm-hmm.
rate up, right? I always find it so interesting. One that like when you think about the body, you think about what drives healing, right? Well, blood, right? Blood is what carries most of those
Mm-hmm.
healing factors. And anytime we exercise, we increase blood, right? It's something like I think 85 to 90% of your blood volume is driven to your muscles and your heart, and while you're doing intense exercise, and the rest is kind of just going to the vital organs, the kidney, the liver, the
Mm-hmm.
intestines, just to kind of keep it alive. But right, a majority of your blood goes to your body with heavy intense exercise. So
Mm.
if as we exercise more intensely and as we exercise more blood gets to our muscle or to our joint area at least, and we need blood for healing,
Mm.
right? To repair said things that have been either hurt on our own or via the surgery. Well, man, you kind of like think about those two just simple things, right? Well, like there's always something to do then, right? If
Right.
if
Yeah.
if that's if like at the end of the day, right? Blood and then moving blood to a certain area is what helps us heal. Like we can always do something, right? So going back, my girl that's had this hip issue, um, she can't really do a lot on it right now, but being a soccer player, knowing she wants to get back to something that's very cardiovascularly taxing,
Yeah.
like we're still doing, ski erg stuff, intervals, trying to
Yeah.
get her heart rate up. Hopefully that so which we can do more stuff and she gets back to running and playing soccer. She's not as, let's say, deconditioned as she previously
Yeah.
was.
Yeah. Are there some easy rules of thumb? Like I think you told me once, work around the pain. So like
Yeah.
don't introduce additional pain to the area, but do stuff that's somewhat tolerable, even though I can still complain about something, but it's not making it worse, but I'm getting all this
Yeah.
load and things that are gonna eventually help.
Yeah, so pain, this is where I make my money right here to an extent. Like so it's not
Pay
as
attention, people. Start taking notes right now. Yeah.
it's not as easy as like because it's a case by case thing sometimes
Yeah.
with pain. So first I would say that pain is not synonymous with damage, first off, right? And just like an easy analogy I always tell patients is when you were a kid, sometimes you fell, you scraped your elbow up.
Yeah.
It looked really, really bad, but
Yeah.
it wasn't necessarily all that painful.
Yeah.
Versus if you get a paper cut, that doesn't look so bad, but like, oh wow, that really stings. And that is a very uncomfortable kind of thing.
Yeah.
Right. And so that's like a simple analogy I use for patients. And so if we know pain is not synonymous with causing damage, right? In your case, it was Achilles base. Well, data research tells us, that loading it to a certain amount and keeping pain below a 3 is actually potentially going to be better because we're making a change to the tissue. We're getting it to adapt and we know we're not causing damage.
Yeah.
It's that you have to, I don't know about sell it, but communicate it in a way to the patient where you can hopefully strike a belief system or a trust and understand that they will trust you to do that with them, right?
Yeah.
When you
Yeah.
came in that first day and I told you, okay,
Yeah.
we're going to load this thing, we're going to
Yeah.
put load on it. Your eyes are like, whoa,
Yeah.
like load, like, aren't I going to
Yeah.
rip my Achilles or rip
Yeah.
this? I'm
Yeah.
like, no, it's okay. Let me
Yeah.
kind of talk you through it.
And everything that I complained about was 3 or below the whole time. Okay, maybe I backslid a couple times
Yeah.
where like this week you had me doing the calf rehab and
Yeah.
now they're sore, so I know I'm going to back off from the protocol. But like, if you stay in that 3 or below, it's such a great general insight for anything that is in the ache and pain category.
Yeah.
Like my mom's 88,
Yeah.
she's in great shape, she walks, she's active, and she has low back pain a lot. So she can do her medicine ball, exercise ball stretches and things that might not feel super comfortable, but they're 3, 2, 3,
Yeah.
3, 3, 4, whoops, 2, 3.
Yeah.
And then you're kind of doing yourself a solid rather than sitting around looking at your watch. When the hell am I going to feel 100% better? Which is, in my age group, I can promise you people never, like it's never going to
Yeah.
be like, I'm never going to be perfect, but can always cover my weaknesses and, try to get more functional in certain ways that I'm lacking.
Yeah, no, like I would say is like just a general, like if you can continue to do things on an injury and the pain is below a 3, you're probably okay, right? Or you just work around it, right? There's always
Mhm.
something you can do, if you hurt your right knee, well, we can still work the left leg, right?
Yeah.
That extra blood flow to the lower body is still going to help us. And we
Yeah.
know sometimes that working the opposite unaffected side is actually going to help the affected side. So yes, there's always something you can do. The problem becomes is right, you get injured and then you get pain. And then and naturally everyone goes, okay, I'm going to rest. They rest 2, 3, 4 weeks. Pain comes down like, oh, no pain anymore. I'm going to go back to my activity. And
Yeah.
so let's just say their activity was running and they normally run 3 miles.
Yeah.
Well, the only thing that happened from the rest
Yeah.
and then pain coming down
Yeah.
was that your pain came down.
Yeah.
But as far as your tissue tolerance, let's say your strength, your connective tissue tolerance, your spring, all that has now come from here to here.
Right.
So do we think we're going to be able
Detrained.
exactly, you've just detrained, right? Like I
Yeah.
think there's like the amount of muscle mass you lose. I think if you look at like studies of people that are sitting in hospital beds because of injuries or just don't move,
Yeah.
it is a substantial amount very fast.
How about the
very
tour
fast.
guys? Have you seen that?
Oh, yeah, like I think right, like the guys that go to space, the tour guys, how
Yeah.
much bone and muscle or mineral density loss
Yeah.
that they have just from
I
being
mean,
on the
it's
bike, not
shocking.
loading.
Yeah. I mean, this is
Frightening.
the research I'm talking about is the tour's 3 weeks.
Yeah.
And when these guys are racing and giving it their all,
Yeah.
they're pretty much sitting on a bike
Yeah.
or sitting on a bus seat or laying in bed. And so they're actually not doing much walking around or anything
Yeah.
that's weight bearing.
Yeah.
And at the end of the tour, their bone density has dropped. Do you
Significantly.
know what? It's some shocking thing. Like, how could that happen in 3 weeks? It's crazy.
It is. It's kind of like I use the analogy of school, right? It's really easy to like, let's say, have an A in a class and get a D on a test. Your A goes from a A to a C minus right away, but to get from that C minus back to that A over the course of the semester or the class period, like that's a lot of effort consistently week after week after week after week. So it is the body detrains super fast. And then it's, consistency all the time that bring it back to a level which you can perform what you want to do.
So someone who does have like an overuse injury as an endurance athlete, or maybe an acute, playing your pickup basketball and you whack something, first thing they should probably do is come see an expert that's sports minded. But
Yeah,
beyond
hope
that,
so.
are there some guidelines to follow for the amateur enthusiast that wants to do right by their body and
Yeah.
not get things worse? But how do you process through these things?
Yeah, so there's 2 questions kind of you asked about acute, I think was one, and what was the other?
Like an overuse
Oh,
injury.
yeah, okay.
Yeah.
Right, so, like, let's say if it's acute, right, again, pain is your guide kinda early on, right? Most people are looking at pain, so
Yeah.
we can go back to, right, if it's pain that's less than a 3,
Yeah.
easy stationary bike is usually, like, one of my go-tos, right?
Mhm.
Whether it's the knee, the hip, the ankle. If we have swelling in any of those joints or we
Yeah.
have some amount of pain, well, we know just gentle motion generally helps pain, right? And while we're doing that gentle motion, whether it's, mobility drills or stretching or easy cycling on a stationary bike, as long as pain doesn't go above a 3, you're probably not doing yourself too much harm.
Yeah.
I think is like a general rule of thumb. In terms of the overuse things, that's one where it's like, okay, like why did you get to this overuse, issue, right? Was it, you upped your training volume too fast, too soon? Did you change your mechanics and maybe how you run or your position on the bike that led to forces being stressed a little differently across the joints? And so it's not quite as simple with the overuse things because there's a symptom, but below that symptom, there's potentially all these kind of causes that can be, sometimes very quick fixes for what you're now dealing with and what you see as pain at the moment.
Yeah. Yeah. I assume that one of the major causes would be just poor overall functional fitness, where you ask some cyclist to go down and hold a deep squat and they fall back on their butt or things like that.
Yeah, so it can be many things. It again depends on the sport, right? Like, if we talk about longevity, right? We know there's like probably 3 physical, attributes that people live a long time that have, right? Big cardiorespiratory system, big VO2 max, strong lower legs, big lower leg mass, and then big grip strength, right? So whatever sport athletics you could participate in recreationally, you probably have 1 to 2 of the 3, right? So like, the guys that are, let's say bodybuilders or powerlifters, really strong, right? Lift a lot of weight pound for pound and probably pretty good grip strength. Cardiorespiratory system, probably not the strongest,
Mm.
right? Our cyclists or endurance athletes or runners, really good VO2 max
Mhm.
cardiorespiratory system. Maybe not the greatest weight to body ratio strength in terms of, let's say, a deadlift, a trap bar, a split squat, that kind of thing.
Yeah, yeah. So if you were going purely for a longevity top
Yeah.
score, what kind of things do you think are the most important?
Oh, that's a good question. So, cover the buckets, do something that fits all
Yeah,
three. So, right,
yeah,
your resistance training is probably number one, right? We just know across all literature, that's kind of like if someone could, I always tell people, someone could bottle resistance training up in a pill, you'd be a trillionaire, right? We could all take every day, right? And you would be done working
yeah,
immediately. Like
yeah.
that would change the world forever. So resistance training, right? It just has so many positive effects on the entire body. And so when we think about the big three, right? Big, strong lower legs, VO2 max, and grip strength, it covers two of the three.
Hmm.
Covers the helping build big, strong lower legs, and it helps the grip strength. And then, so if you do some type of resistance training, and
Mm.
heavy again is relative, right? I have 80-year-olds that I treat all the time. They squat 20-pound med balls. For them,
Mm.
that's really heavy.
Yeah,
For you and I, right? That's like, I could probably do 100 of those, right?
yeah.
And then on the other side of the spectrum, right, is your cardiorespiratory fitness. So probably something really, really fast, sprinting,
Mm.
right? Sprinting, we know that as you age,
Yeah,
type 2 muscle fibers, your power goes really fast. So if
yeah,
people trip and fall, they can't catch themselves.
yeah.
So something that's, sprinting or something plyometric, right? Where you're trying to create force really quickly within the
Yeah,
body. So
yeah,
I would say those are right, your buckets. Do something heavy, slow in the weight room, do something really fast, whether it's in the weight room or sprinting. And then, probably everyone's like this zone 2 kind of thing, something long and slow, right? Where your heartbeat fills all the way, contracts all the way.
yeah. I appreciate how you mentioned sprinting right at the top there, because cardiorespiratory fitness is not only developed with steady state, long distance endurance training. And I think with all this hype around zone two
Yeah,
and
yeah.
people putting these checkpoints up, like for longevity, you need this, this, and this. I think we've kind of lost sight of the fact that if you do a resistance training session where you're going in and doing the 7 machines, with a couple sets and going out, you're getting a cardiovascular workout during the whole thing. You're
Mhm.
building your cardiorespiratory fitness
Yeah.
with any activity that you do. So, as a longtime endurance athlete, talking to another, we're going to talk about that shortly. But that's great that we have the capability for these competitive circumstances where you're going and pegging your heart rate up high and giving them the most up, trying to get a VO2 max type of effort.
Yeah.
But for a lot of people, you play basketball for an hour, you stand around a lot, you sit on the bench, you come back, you're still getting an excellent cardiovascular training session
Mhm.
for the entire experience.
Yep.
It does not necessarily have to be steady state. Now, I also think that we don't move enough in general everyday life. So a huge void is not necessarily the number of hours that you're pegging at zone 2 on your stationary bike, but the fact that you're sitting on your butt all the time working on your computer and not even taking 2 to 5 minute walks on the hour, which would greatly improve your health, longevity, and everything else.
Yeah. Yeah. I mean, I totally agree. Right.
Yeah.
It's, the analogy I always tell people is that whenever I see endurance athletes in the clinic, it's kind of like they don't have a trainer. They're generally not doing enough stuff that's really fast and hard, and they're not going
Mm.
slow enough. Everyone kind of lives right in the middle where they're like, oh, they go hard, and they think that's what drives it forward, but it's not hard enough to make an adaptation.
Yeah.
Right. And then they also just don't go slow enough to make that adaptation. Like the extremes seem to be where where everything that raises the ceiling, as opposed to if you just always live in the middle, right?
Yeah.
If we always just do 3 sets of 10 in the weight room,
Yeah.
we plateau at some point.
Yeah.
If you always go for your run, and let's say, you do a 7:30 pace or an 8-minute pace, for a lot of people, that's kind of like not super, super fast, but
Yeah.
that's relatively fast for them.
Yeah.
Well, that's not really going to help you run that 6-minute mile consistently,
Yeah.
right?
Yeah.
Just like 3 sets of 10 isn't going to help you, deadlift more weights. You'll
Yeah.
plateau, right?
Yeah.
You gotta do something more intense, right? So
Right.
do some sprints, lift heavier weight for less reps. 4 sets of 5,
Yeah.
3 sets of 5.
So when you were at Axos around these very top level athletes, and I also want you to talk about your experience with the Olympic track and field athletes, including gold medalist Andre DeGrasse from Canada, who was
Yeah.
training down at the same facility as
Yeah. Yeah.
you. Or that was Altus. That was a different place.
Same
But
place.
oh, okay. So
Altus
every
kind of was in using the Exorcist
yeah. So
facility.
so tell me about these facilities that are now kind of the ultimate cutting edge, and then also what the athletes are like, and what's their overall training pattern and
Yeah.
lifestyle that you see
So
attributes.
so cutting edge, I guess like we define cutting edge. So like right, like you don't actually need a lot of fancy equipment. Now the facilities I had the pleasure of like being able to work in and be around, like they did have some really cool fancy
Mm,
equipment. Um, but it wasn't necessarily like, it looks really clean, it's really kept, really well kept all the time. So that makes it look like, oh my God, this is the greatest gym ever. But I think what makes the facility like are the minds in that facility, like who are the coaches, who are the PTs, who are the people running it, and then the culture,
yeah.
right? So it's in the culture usually in the greatest facilities is a culture of excellence.
Mm,
Does everyone walk in the door? Does the entire team, the physical therapist, nutritionist, the strength staff, they all walk in and do they want excellence out of themselves or they want excellence for their athletes, right? So
yeah.
for me, that's what makes a facility world class. It doesn't necessarily have to be like the prettiest gym, the biggest gym, as long as you have enough of the right things
Yeah.
and you have minds that strive for excellence and want the best, and you have athletes that also want that excellence.
Yeah.
Bam. Now you've got a recipe for like, gold medals.
Yeah.
Um,
That's cool. Instead of the sizzle,
yeah.
you're going for the heart of it, like the Kronk Gym in Detroit,
Yeah.
where Thomas Hearns and many other fighters came out of. It was a shithole, but it
Yeah.
was a place to
Yeah.
get to work and build the greatest fighters in the world and make them tough. Now we have a
Absolutely.
little bit of a balance of a cooler environment to train in that's amenable and clean
Yeah.
and all that. That's great, but I appreciate you putting that at the top. And so for you, like when you come to work, I see your level of focus and also perhaps tending to more than one person over the long time frame. Like we have our individual engagement and
Yeah.
hands-on, and then I'm sent off to the kettlebells to go do my reps and come back and complain. But you got a lot going on all
Yeah.
day in both a hands-on mode and also in your head when you're looking up to show me what that pizanserine pain and all that.
Yeah.
So like, what does it mean to you to come and bring your A game every day?
Oh, that's a good question. What does it come to mean bring the A game every day? Hopefully providing value that the patient expects, right? And if I can provide value that the patient expects, um, and hopefully that value is, usually most people that come to physical therapy, it's usually pain related, right? So it's bringing pain down, but
Usually.
so first off, it would be like, do I provide value that the patient expects? And can I exceed it too? Right. And so exceeding it for me would be I help them in a performance way in some way, shape, or form. Right.
Yeah.
You came to me, a couple weeks ago, like Jonathan, this is turning. I was like, okay, cool. Well, let's deal with it. But I'm hoping that the things I actually give you not just help with your pain, but we talked about you, right? The events you do, you're a high jumper, and then you run like the 400. Those are, to an extent, very different events. High jump is very explosive. And the 400 is more like, I'd say cardiorespiratory base, right?
Yep.
But the the need to be, I would say, have a strong musculotendinous unit together and be stiff, is beneficial for both, right? So
Mm.
I can use exercise and I hopefully provide a value that you expected getting you out of pain, but then hopefully the exercise I use to get you out of pain also increased your performance on the back end.
So you mentioned stiff, and you want to see those tendons stiff and able to handle a lot of load. Can you tell us about those discussions we've had
Yeah.
where I
Yeah.
think you described that like the reason I came in here beat up with a pretty serious injury was like my muscles were too strong for my tendons, which weren't stiff and rigid enough yet because my training for my whole life has been endurance and
Yeah.
nothing
Yeah.
with heavy load. And so we need to strike this balance between like muscle strength and tendon rigidity or
Yeah.
stiffness.
Yeah. So there seems to be potentially like a bit of a balance between, muscle strength and how much force the muscle can produce and it can handle and the type of stiffness that the tendon has, right? So, let's just say, right, we're a cyclist and all we do is, it's a very cyclical action, right? And so they typically don't do a lot of weight training.
Mm.
But, I don't know anyone that's seen a cyclist that doesn't have pretty robust thighs, right?
Yeah.
So a common thing you see in cycling is, right, you get that tendonitis of the quad tendon, the patellar tendon, right? And so they haven't done a lot of heavy and slow
Mm.
meaning the weight training, right? So the heavy and slow is essentially what is going to make the tendon stiffer. If we want to get in the cellular part of it, there are these cross links within a tendon fiber that when you do heavy and slow resistance training, that puts down more cross links. So right at a physiologic cellular level, that is what makes a tendon stiffer, like itself, right?
Mm-hmm.
And so if you have a muscle that's really strong, always pulling on a tendon that doesn't have, let's say, at a cellular level, a lot of cross links, a lot of stiffness to it,
Yeah.
right? You can get this overuse tendonitis,
Uh-huh.
inflammatory issue, and then it could be, chronic tendinosis where you get like degeneration of the tendon. And so again, right, there's this balance. They have big, strong muscles that can create a decent amount of force, and then tendons that haven't been loaded in a way that puts down more cross links
Yeah.
and less and less. So, and then on the flip side, right, we've got like, let's say, our basketball players maybe jumping up and down all the time, or track athletes, on this hard surface, where you're asking your tendon to create a lot of force and get stiff really quickly, right? Well, if they don't do enough strength training for their muscle to handle this, the jerk that the tendon gives back on the muscle to an extent, right? You get these muscle pulls, these calf pulls, these hamstring strains.
Right.
So there does seem to be a bit of like, give and take in terms of how strong the muscle is and how much force you can handle back from the tendon, and then how stiff the tendon is and how much jerk or pull it can handle from the muscle over and over.
That's really cool to look at it that way. And so I guess you're looking at your weakest link when you come up lame with a hammy, or in my case, my calf muscles and hamstring felt great. And then I was growing this bone spur on my heel, which didn't seem right. Talk about how the bone spurs developed in the body.
Oh, that is super nuanced. So I don't know if I'm the best person to ask, but right, in kids it's called like severs or severs, and then in adults they just kind of call like, right, it's a Haglund's deformity is like the fancy name for it, and then just most people, the layperson, knows it as, right, it's this bone spur, it's this extra bone calcification. So I think the easiest way to boil it down is that there's a law called Wolff's Law, and it's really interesting in the fact that everything that we all do in our daily life affects our body physically. So let's just say cyclists is an easy example, right? They're on the bike all the time. So they're not putting a lot of load or stress through their hips, through their low back, in any way, shape, or form. So if you look at the bone density of a cyclist, their femoral neck bone density and their lower back bone density is quite low compared to the average person, right? There's no stress going through the bone. So the body thinks and doesn't tell it to basically put more bone in that area, right? So if you look at, let's say,
Wolff's Law is like the bone needs to be stimulated in order to get stronger.
Exactly, right? And so like a good example is, let's say, in hockey and soccer players, they develop some hip issues where they get extra bone growth, or bone spurs as we call it, right? And it's called FAI, and that is potentially, an overuse, but an adaptive thing, because they're putting so much stress and force through the pelvis, the acetabulum, the femoral neck, that extra bone gets laid down because the brain and the body, like, oh wow, we're putting a lot of force there all the time. We need to maybe protect this area and create more support here. So let's lay bone down. So it's kind of like an adaptation for the sport, but in the long run, in the health of the joint, it can have negative implications. Just like cycling, the body not putting bone down there it thinks it doesn't need to, but for longevity and health of that joint, that's not a very good thing either. So circling back to kind of so these this extra bone in these areas is probably just due to stress, extra load, right? You giving what you do, you put a lot of stress through your Achilles and your ankles based off the sports you participate in. And so it's mostly probably due to that, essentially, just stress.
I mean,
concentrated
it was like, if you're watching, maybe you can see my heel. Actually, it looks pretty good now, but I guess you told me like the tendons kept pulling away, and then the bone fills in the gap where I'm not strong and rigid enough to handle that pulling on when I jump in the air or something.
Yeah, right.
And so it's like filling a gap that it's not supposed to, as opposed to getting strong bone density when you're doing nice controlled strength training or appropriate physical loading, where you're getting a nice strong femur or whatever inside your body.
Yeah, no, you hit it dead on. It's again a balance of, the tendon connects to the bone, and there's this blending of collagen and periosteum. and you can get avulsions, right, where the tendon or the muscle pulls off of the bone and pulls a little bit of bone with it, right? That would tell you that the bone couldn't handle the force of the tendon and the muscle's force that
Yeah.
pulled on it.
You're talking about over time too.
Yeah.
This is not like an acute injury where you get whacked in a car wreck, but like the avulsion is coming from day after day after day, beating
Yep.
yourself up, feeling those pain warnings,
Yep.
and then, in my case, warming up and feeling better, thinking I was fine.
Yeah.
But then over the next 24, 48, 72 hours, I'm like filling in bone where it's not supposed to go, I suppose is happening.
Yeah, but potentially, right? We can really go down in the weeds, but very simply, yeah, it's potentially an overuse thing where bone or muscle and tendon pull on the bone over and over and over and over, and for some reason that bone is not able to handle that load, that stress of
Yeah.
the force on that, and
Yeah.
so it pops, right? You feel it pop, or you get like what's called a stress reaction, which is what
Boom.
would be prior to an avulsion, and you get pain there, and it's kind of like a hot spot on like an MRI or
Yeah.
an X-ray.
Let's talk about pain for a moment. I think I was listening to a recent podcast where the conversation was like, pain's entirely in the brain and your muscle doesn't really hurt. It's only that your brain's sending a pain signal, something like that. It
Yeah,
was kind of
yeah.
a thoughtful way to look at it. Obviously, everything's happening in the brain, but maybe you can give your take on,
Mhm.
because earlier you said pain doesn't necessarily mean injury
Yeah,
or something
yeah,
like
yeah,
that.
yeah.
So
Pain doesn't
what's going
isn't
on
synonymous with
when we got
damage.
our aches and pains every day?
Oh, that's a big question.
Yeah,
I
yeah.
am
It's pain 101 college class. Yeah.
yeah, I'm by no means the expert in this whatsoever. But so pain can come from many
When
ways.
people say that, this is what I want to call you out on. When they say they're not an expert, they have vast knowledge of the subject and they know so much that a lot of times you're calling yourself not an expert because you've had so much exposure to it. As opposed to, I think we need to do a little commercial here for like a social media education awareness public service announcement. Because when you hear people spouting on 17 different subjects and they're very emphatic and like precise with like, this is the deal with diet. What you got to do is you have to start with an oatmeal bowl with 17 grams of protein every day because your body needs 17 to 27 grams. It's like, really, dude, you're full of shit. You don't know much, but you're really precise and focused and you sound convincing. But the smart people I talk to, they always couch stuff with like, well, I'm not an expert, or like Dom D'Agostino, one of the world's leading experts on the ketogenic diet. He said, I don't know, so many times in our interview. I said, dude, it sounds like, you said this so many times. Like, what's up with that? And he goes, be very careful with people in the scientific community who speak in absolutes, because the more you learn, the more you understand how much you don't know. So now we teed him up as the non-expert in pain, and we'll get some insights.
So in terms of like sports orthopedic pain, right? It can be. Oh, I got to start. So what was the original question around
like
pain?
what is really happening when you have these signals and aches and pains happening, that the brain is sending a message to, I guess, protect you or that sort of thing. That's what we hear a lot.
Yeah. So right, there are many reasons people could have pain, right? If you break a leg, that's obviously we know why we have pain, right? There's a physical structure that has been compromised in some way, shape, or form, or like we tear a ligament, right? So I think those are fairly obvious, right?
Yeah.
So it's really you're gonna want to understand what the mechanism was and maybe why you had pain, right? So let's just say, for example, people that let's say you haven't done anything in a long time. You're like, I want to be a runner. Okay, love that. Let's go get active. Let's go exercise, right? They go run. They said, I'm going to do 3 miles. I don't know why 3 miles. 3 miles is like in running. You ever notice like that's like the distance every casual runner person getting into running. I was like, I'm going to run 3 miles. I ran 3 miles today. I'm going to run 3 miles tomorrow, kind of thing.
That's probably the most I should ever recommend anybody run, by the way. Anyway, go ahead. Yeah.
So, so let's say they decide to become a runner and they go for a run, right? And they've never run, 3 miles in their life. And so then, the next day they're like, oh my gosh, I'm sore. But like for the new person that new to exercise or some form of exercise, they might say that is painful.
Yeah.
I'm like, okay, well, like, is that muscle soreness pain? Right? Like, because soreness pain is like, that's significant soreness. And, we can get into some of the details around that in terms of like soreness we think is actually a very cellular thing, actually
Mm.
not so much a damaged thing from a healthy perspective.
Oh,
Maybe that's a way to frame it. So if you were to go, let's say, lift heavier, I were to weight train, and maybe I haven't weight trained in a month, and I'm like, I'm going to do split squats and a bunch of lower body
mm,
stuff, and I wake up the next day, I'm like, oh my God, my hamstrings, my butt,
yeah,
I can't walk, right? Like, I
yeah,
don't say that's pain. I'm like, okay, that's soreness,
uh-huh,
but that soreness isn't because I've now shredded my muscles. It's not exactly, it's not as simple as saying my muscles have been damaged. Now I got to eat protein. Well, there's a lot of cellular reactions that go on in this process. And because of the ions and things that are required for these cellular reactions, those have a lingering effect on the body 24 or 48 hours later
yeah,
that we perceive as pain
yeah,
or soreness
yeah.
versus, you know, someone that, broke a leg.
So is it like inflammation and fatigue from the actual muscle fibers that's making you feel super sore and stiff the next day?
In terms of like, so you're asking in terms of someone who's healthy when they
Yeah,
feel
and did your
soreness, the
split
down.
squats and you weren't used to it.
Yeah, so
Yeah,
in terms of someone healthy, you're asking the next day, okay, what does their soreness do to, or what does that like perceived pain do to?
yeah,
Right? Well, I would say simply one, it's you just ask yourself, your body was not prepared to do that exercise for that amount of time, for that many reps, for that
mm,
much load, for that cadence, for that speed, that intensity, right? It just was not prepared.
mhm,
And we know it's not prepared because you feel soreness maybe for 3, 4 days.
yeah,
Right?
yeah,
And so then, right, you're asking, okay, what does the soreness cause? What is the cause of soreness? Is I
yeah.
think what we're getting down
Or
to.
it was what represent too.
Yeah, well, it represents some amount of physiologic fatigue,
Yeah,
right? And that
yeah,
okay, your body was stressed,
yeah,
a good stress acutely. We now need to recover and listen to our body, before we're ready to, do something again or do something
yeah,
intensely again.
yeah. Is it true, like when you have like extreme tightness and soreness, that if you were put under anesthesia, you would actually be super flexible? Like you heard that one
That
too,
yeah, that
where
is
it's not really a tight
yeah.
muscle. It's the brain saying, "I'm tightening your muscle up, fool, because I don't want you to
Yeah.
rip it apart."
So that's such a good question. So it's so interesting. So I found like as I practice as a clinician more and more, I think a back is a good example. So right in our low back, we have these vertebrae and we have nerves that come out either side. Well, those nerves and those nerve roots, they control how our lower body muscles feel and then actually control our lower body muscles contractions. So I see people in here that I've been working with for a long time, and let's say they lay on their back on the table and they bring their leg up to 90 degrees, right?
Yeah.
Perfectly. Like you're a perfect example,
Uh-huh.
perfect 90 degrees. And then they go off, they're doing their exercises, and a couple weeks later, like, oh, Jonathan, I hurt my back, right? I'm like, okay, well, let's evaluate it. If I ask them to do a straight leg raise, and I know healthy them gets to 90 degrees
Yeah.
and they stop at 55,
Uh-huh.
and they're like, oh, that's really tight, or
Uh-huh.
like that's painful.
Yeah.
Well, is it because they don't have the actual physiologic length or tissue mobility to get to 90 degrees? Or is it that they're getting a signal from their brain that's from their back that is now saying, hey, don't move this far because we could cause damage or because that hurts or
Yeah.
we have so much fatigue and perceptions and feelings of tightness
Yeah.
that you no longer can move,
Yeah.
in the original range of motion you had.
Right. So the answer is they have the 90 and then they are
Stressed.
getting
Yeah.
limited by the brain,
Yeah.
I
Yeah,
guess.
and they're getting
Yeah.
limited by the brain and, that'd be maybe centrally and then peripherally, it would be due to the stress or the pain of a local area, whether it
Yeah.
was the pain of the local back or you sprinted, you did, repeat VO2 max stuff the day
Well,
before and you came in, you're like your hamstrings are shot, right?
yeah.
But before the workout, you're totally fine.
Okay, so now what do we do with the information? Like, do we always honor these aches and pains and soreness and stiffness and adjust workout and strive to never
Okay.
feel that way? Because I'm still struggling with this every day. Like, what is the best decision to make for my workout decision? And when my back was stiff for 12 weeks from, I guess, that acute injury of deadlifting without warming up,
Yeah.
I'm like, dang, what do I do? Like, do you, because it feels like if you warm up and get in the flow and get warm,
Yeah.
sometimes the pain and the stiffness gets put on the sideline so you can go crush it and then seemingly dig yourself a deeper hole. Like, how do we navigate that?
That's a really good question. So I would say two things. One, you can look at it peripherally, so like
Uh-huh.
how your muscles feel just from a soreness perspective,
Yeah.
one, and then you can look at it centrally. And so what I would say centrally is, right, everyone's heard of heart rate reserve.
Mm.
Super fancy. I'm not saying go and look at heart rate reserve and use that as your metric, but maybe just look at your resting heart rate in the morning. When you wake up, say you use the restroom, sit down for a sec, put your watch on, your heart rate monitor, and see what your resting heart rate is that morning. If your resting heart rate is, let's say within 3 to 5 beats of what it normally is, okay, you've probably recovered maybe from a central perspective,
Yeah.
at least cardiovascularly,
Yeah.
that you're ready to do something again. Now, peripherally, right, we talk about that could be perception,
Yeah.
right, or it can actually be, fatigue neurally and at the muscle. So for that, I tell people, hey, look, if you do a workout and you do, let's say, like a lower body day, and you're asking yourself when you want to do another lower body day,
Yeah.
well, obviously there's at least 1 day rest, right?
Yeah.
Let's say you get to the second day and you're still pretty sore, you still feel that tightness,
Yeah.
right? Maybe wait 1 more day, right? So I kind of just generally say, look, you should be able to do a good workout. And if you recover you should recover within 1 to 2 days from that. So 48 hours,
Yeah.
and you're probably ready to hit it pretty hard again. And if you get to the third day when you're like, okay, I'm ready to hit it, and you're still like walking around, like, oh man, I feel really sore still,
Yeah.
at least peripherally within your legs, it might be best just to wait 1 more day.
Yeah. Yeah. Here's the thing I'm noticing. Like I bottom out not an hour after the hard sprint workout, but it's more like somewhere around 48-hour mark is where I really make my checkpoint to see what that workout did to me, especially with regard to managing the injuries. In other words, like my foot does not feel hot at the end of the workout because I warmed up and I pushed it and it's inflamed. It feels fine. But then 2 days later, how am I feeling? I feel like I'm on to something good as far as managing because I screwed up before going out to the track, getting excited, ready to kick some butt, warming up, bringing the blood flow, and then that ache and pain, that stiffness that I woke up with is completely gone. And that tricked me every time because I'm like, well, I feel fine right now. And yes, I can do 2 more reps. So how does the athlete manage that? Because otherwise they're coming in to see you and telling you the stories about that stuff.
Yeah, so for like the common everyday athlete, right, I would say, right, just assume that if you do something really intense, whether it's, intervals running or on a bike, or it's a heavy lower body day, right, there is probably just 48 hours that you're going to need to probably not do that same stimulus, the same exact stimulus again. I think as a general rule of thumb, 48 hours, right, is check back in with your body after 2 days to see how we feel.
All right.
As, let's say, our resting heart rate in the morning come back to normal. Do we have that lack of soreness, right? Has that kind of dissipated? Not that soreness itself is like the best marker, but for the average person that doesn't have maybe access to all this tech, and without looking at your whoop, right? Again, whoop is central, right? It looks at your sleep, right? Your heart rate, your heart rate reserve, your heart rate recovery, those kinds of things. So that's very much central, but peripherally, how you feel. I think people are generally pretty good judges of when they don't feel good and when they feel bad. So for the average athlete and the average person, if you do a big workout, whatever it is, check in with your body after 48 hours. If you feel like, okay, that soreness, that issue is dissipated, and your resting heart rate in the morning is kind of back to where it should be, you're probably good to go.
I like how you split it up between central and peripheral, because like as an endurance athlete, and then we're going to kind of, before we wrap up, I want to ask you a little bit about your cycling endeavors now, but like now I'm realizing like as an endurance athlete, it's almost all central. I didn't have, injuries and knickknacks. It was just, is my heart rate low enough? And do I feel the energy to go slam again? Because it's swimming, biking, and running. The load is dispersed anyway. I almost had 0 injuries through my entire triathlon career. If I had a hot shoulder for 3 days, I'd just pedal my butt off and everything was fine. But it was a constant struggle to get that central recovery going. And now I feel like the opposite where, look, if you tell me to go and do 2 track workouts a day, I could carve the time in my busy schedule to do it, but my body would disintegrate. You know what I mean? It's totally different.
Yeah. So the central versus the peripheral, right? And you could say within central, like I used heart rate as like the metric,
many
right?
other things.
Right. We could say the nervous system too, within fancy sports, professional sports, right? They use like force plates and they have the athletes jump, right? And do some types of jumps. And there's certain metrics that they look at that they find this is a decent barometer of them measuring your central nervous
That's a great
system
idea. I love that.
fatigue, right?
Yeah.
And
Have you
so
seen the app, the tap test on your
no,
phone? My
no.
friend showed me this. It's called the CNS tap test.
Okay.
And you download this thing and it says ready, go, and you tap as fast as you can for like 10 seconds.
And if you
And
don't
if
give them
you
a certain
get to,
amount,
my record's 82 or something. And so I can get from 78 to 82 if I'm really sharp. And it's really tough because you got to like stay in the rhythm. And supposedly, if you're a little central nervous system fatigued, you'll have a lower score. It's kind of
that's too
cute.
cool.
Yeah,
Yeah, no,
we're trying different ways to like, but that force plate thing is awesome.
that's
You know,
it's funny that you brought that up because right with the force plates there's a jump that they do where they'll basically kind of do these pogos in a row
yeah,
and they'll look at kind of basically how much time they spent on the plate and how high they jumped
yeah.
and then
You
the
had me
overall
do that
number.
test. I
Yeah,
was a little disappointed on some of my scores. Some of them were okay, some of them were pathetic. So there's always something new to
there's always something to
strive
work
for.
on though.
Yeah, yeah,
But it's funny the tap test, right? It's again what you're saying is it's speed.
yeah,
Right, you're asking someone to
yeah,
do something really
yeah,
fast, right? And so if
yeah,
someone has to do something really fast, that demands a lot from the nervous system in
yeah,
terms of how the nervous system and the muscles work together.
yeah,
And so it's the same thing in pro sports with the force plates. They're asking them to do something really fast,
yeah,
really hard, just once or twice maybe, and then they can get like a litany of data on just one athlete, and they'll do it for everyone on the team. And if you're outside a certain, let's say, standard deviation, what your normal spread is, it's kind of like yellow flag to red flag. Hey, look, we might want to back off training for this person there or give
you're-
them a break. But obviously, the lay person, that doesn't have access to stuff
yeah,
daily, at least at the moment. I do think in years' time we will. But like,
mm,
if I could give, just your audience just one quick thing, if they want to experiment and have fun, there's an app called My Jump 2, and you can use the app to look at your vertical jump.
wow,
But there's something on there called rebound jump or RSI, reactive strength index. And so it's these pogos. And so if they wanted to, they could do this every day, right? And
uh-huh.
just take the app and the camera watches them and it gives them their number.
Wow,
And then they could just, track these on an Excel doc or just remember it too. And if they're, so far away from so many standard deviations away from the number they normally get, they
yeah,
would know pretty
yeah,
quickly, oh, wow,
love it.
my muscles and nervous system are like probably not great today.
Yeah,
But in general, if the muscles don't feel great and
pretty
they feel
simple.
sluggish,
Yeah,
it's pretty simple. Like,
yeah,
if at 48 hours you're still pretty sluggish still, maybe wait
yeah.
another 12.
I talk about warm up a lot and how I feel with
Yeah.
my dynamic stretches, my drills, and my wind sprints. And if they feel off, obviously it's not time for,
Yeah.
the proper high intensity session. Same with, I think, endurance. You step out, you're pedaling for 20 minutes, and then you kind of know where you're at, whether you should turn around, which happened to me a lot, or whether you should continue for 5 hours.
Yeah.
It's pretty cool to be intuitive, but also take advantage of all the tech. And so maybe that leads up to a question. When you're around those top athletes and the greatest Olympic track and field athletes and the NFL guys, do you see a future breakthrough and more things coming in? Are they at a really high level right now? Are there some envisioned optimizations coming that will even make these guys stronger, more resilient, less injurious, whatever?
Oh, that's a good question. I think recently people were talking about like they don't think that like athletes have gotten that much better. Like we could talk about track, right?
Oh,
Jesse
yeah,
Owens
yeah.
versus like
I
Usain,
know,
and then
yeah,
the
with all
difference in
the
time.
conversions.
Yeah,
Yeah,
right. People do these
yeah,
conversions, the math and stuff. I'm
yeah,
like, oh, if Jesse had these shoes, if he had this
right,
kind of training,
yeah,
could he have done what Usain has done or Andre DeGrasse, some of these world
yeah,
class elite runners?
yeah,
But in terms of like what I see as the future, like maybe where the next boundary is going to be made, or in terms of it's like, oh, probably recovery, right?
right,
Like I think if you think about like the Tour de France and
yeah,
like all these guys are going faster and faster and the climbs are better and better and better, the
yeah,
times they're doing them, it probably comes down to recovery. Like, every little, the food that they eat, when they eat, how much they eat, when they drink, how much they drink, what are they
yeah,
drinking? What are they doing in their spare time to just optimize? So it's probably not one thing,
yeah,
but like what they're doing outside of their performance in
yeah.
terms of the recovery,
One of the things I'm thinking of these days is like all these athletes are now on social media all the time
Yeah.
and engaged in the digital world like the rest of us.
Yeah.
But Hickam El Garouge, the greatest middle distance runner of all time, he lived in a dormitory in a training camp high in the Atlas Mountains for
Yeah.
9 months a year. And like his hobbies were reading magazines at night and praying to Allah. And that was all he did
incredible.
was train, eat, and sleep. And it's like, I think we've passed that point where the most dedicated athlete on earth, like El Garouge,
Yeah.
now you can't match that because now you're obligated to sponsors and appearances and all
Yeah.
this crazy stuff that definitely affects recovery, I think.
That's amazing. It'd be, as opposed to adding something more to optimize, it'd be taking things away,
Yeah,
right?
yeah. Simplifying one's life as
Yeah.
an elite athlete.
Yeah.
Yeah,
No, I
yeah.
definitely could see that, right? Like all the stimulation we get from social media and the phones and all that. Yeah, absolutely.
So you're also a competitive racer. So
I don't know about competitive, but
let's
I
wrap up
try.
with talk about your
I try.
passion and kind of how it blends into your practice and makes you a better practitioner. Because I mean I have great respect for someone who's out there slamming while they're taking care of people and dispensing information. So you're
Yeah.
out there doing competitive. Is it cyclocross
Yeah.
and
I love
yeah,
bikes.
yeah,
Yeah.
yeah,
I love racing mountain bikes and doing what's called enduro racing. I think that is so fun to me. The adrenaline rush. I love the combination of the strength you need and the
What do they do on
cardiorespiratory.
enduro racing?
So enduro racing is where you ride your mountain bike down the hill as fast as you can,
Yeah,
and they time the distance, or they
yeah,
time how fast you went that distance, and then you have to then ride your bike to another stage. So there's like 4 to 6 stages. So
uh,
4 to 6 times you go down the hill as fast as you can.
yeah,
So they time all that time. So it's the adrenaline rush and the skill of riding your bike down a hill as fast as you
yeah.
can, but it's also the cardiorespiratory fitness of you have to go from the bottom of one stage to the top of the next stage, which could be 1,000-foot climb, and that takes you, a certain amount of time,
Yeah.
right? And so you get this accumulated fatigue across
Are
the
you
day.
timed on the climb or
You're
is
not
it
timed
only
on the climb.
so
No.
if you take a lot of time, you're still out there in the hot sun climbing a
Yeah.
1,000-foot climb. You still got to get up to the top.
Yeah, right. And
Oh,
so,
wow.
yeah, so you're not, I shouldn't say you're not timed. You do have a certain window you have to make it in, though.
Right.
And
Yeah.
it's usually a window that is big enough where it's not a rush. You
Yeah.
can kind of leisurely,
Yeah.
moderately pedal we'll call it a zone 2 pace
Yeah.
kind of thing.
Yeah.
And you'll make it there with plenty of time to kind of like
Yeah.
rest, get some food, drink some water. But yeah, you're still out there 6 hours kind of doing your thing.
And what about the descent? Is it all technical or are you pedaling too and generating watts to improve your time?
Both, right? It could be
Yeah.
very, very technical. And then, you could come down a technical area into a corner that's 90 degrees the other way, but you kind of almost come to a stop. So then it's
Yeah.
like a whole lot of watts for 10, 15 seconds to like get up to speed again before you go down another technical section. Then you might have to come to like a slight stop or slow down a lot, and then you're
Yeah.
up to speed. So it's
Yeah.
this very stochastic
Wow.
kind of riding
Wild.
almost.
All right, man. Keep doing what you're doing.
Thank you.
Dr. Jonathan Sanburg here at Kime Performance Physical Therapy at Ultimate Fitness Gym, Sacramento, California. There's a bunch of locations in the Sacramento area, but
Yeah.
you guys also have a cool website. And of course, we got to plug the Kime Cast
Yeah.
with Tony
Yeah.
Nicholas, the founder. I just appeared on that recently, and it's really cool. He talked to me sort of about the background of the podcast and why they're going to this great effort to do these nice productions. And one of the things he mentioned, which was super interesting, was like the recruiting aspect. So
Yeah.
knowing this operation is so dedicated to sports performance and dispensing education and information brings the top level talent to attract, which I believe is a difficult thing these days, is to find the very best of the breed when you're hiring new people.
Yeah, I mean, Tony's, he's the CEO, he's the commander in chief. He oversees everything for us, and he's and Russ Dunning, his co-business owner and partner. I can't say enough good things about them, but yeah, it is hard to hire people that have this drive, like we said, for excellence, that they want to come in every day and be excellent themselves. And hopefully we get athletes and people like yourself that they want to be excellent themselves, that we can collaborate together and and improve the world to have a healthier, happier people.
So if someone's listening, watching, and they're not in the Sacramento area, maybe they're international or anywhere across, how would you scrutinize or navigate to a really top quality, performance-minded, cutting-edge physical therapy support practitioner?
Easy answer.
Oh, okay.
So if it says
Call them up and
sports,
say, how many watts can you put out for an hour, an anaerobic threshold per kilogram of body weight?
No,
I'm
no,
about
no.
5.2. I'm going for 5.3.
No. So it would be, if it says sports performance on their website or their building says sports performance, look at photos of the place. If they have weight racks, you know, dumbbells, trap bars, if they have weights 5 to 100 pounds, you're probably in a pretty good place.
They're probably not BSing either. They're probably not just sitting there. Now, if you do go in and see everything clean and pristine and all the 5s are in the slot and the 10s are there, I want shit messed up and dirty and the kettlebell's over in the corner. Yeah, that's our kind of place where people are doing work, man.
Yeah. So
okay, so that's number one is a fitness related environment.
Yeah, so that's number one. If it says sports performance and they don't have the weight racks, the weights, they're faking it. I'm sorry, you're faking it. And then 2 would be, you know, maybe look at some of the degrees of the people where they've worked, right? On Kime's website, we all have our bios and, you know, the environments we've all been in. So if they, let's say, have, you know, if they have a CSCS, which is like a strength conditioning coach certification, that's what you would want to see. So like your doctor of physical therapy, your master of physical therapy, and then your strength conditioning coach, CSCS, I would say those 2 basic letters, right? It would be like that. With the weight room, you're probably in pretty good hands, and you got someone who's like-minded like myself in sports med and is going to do the right thing.
Love it. All right. Thank you for watching and listening, everybody. Thank you, Jonathan. Keep up the good work.